Hi, this is Dr. Bill Kottemann again. So we're going to order some additional aligners. After seeing how we're coming along, I do want to do some IPR to reduce her overjet a little bit. And so we just, for our special instructions, put in we want to IPR the upper arch and do the same over corrections that we had in the previous ClinCheck. So we don't have to write them all out once again. And so now when we look at the refinement, you can see we've got wall-to-wall IPR. We only have 5 aligners, and you can see that we're intruding both upper and lower teeth. But notice it's a fair amount of retraction that's taking place when we do the IPR. So that helps quite a bit. For whatever reason, the ClinCheck does not show the bite jump from the intrusion, but that's okay. We know we're going to get that. So I approved this ClinCheck, and so now we're going to start pulling more on the molars, and so it's kind of hard to see, but from our TAD we have an elastic going over the occlusal into a little notch cut out in the aligners so that we can pull up on the posterior teeth more directly. The lower TAD loosened up as we finished the treatment, so we removed it. And now notice that we are still continuing to treat the intrusion of those posteriors. She has her viveras in place. And a critical point here is that the viveras are made from her ClinCheck, not from her mouth. So we have the ideal intrusion still built into the prescription, and so any more movement that didn't work out in the aligners can finish working out in the viveras. And now we're pulling with 2 wider spaced notches to get more intrusion taking place. So she's wearing her retainers. We're done moving the teeth per se, other than wanting to intrude those upper teeth to close her bite just a little bit more. And so we got good bite closure and settling of that bite after a few extra months in the viveras to settle that. And she was just thrilled at the bite closure. You can see, and we'll show a before and after in a minute, how the cant dramatically improved. We also importantly equilibrated the teeth, because some of these crowns were done when she had the tumor still in place, and so they were all made when the occlusion was much different. So important to equilibrate old crowns. We're going to leave the TAD in just to make sure we don't need it or there's any relapse. And so we can see that we've achieved a really nice change in the cant, and certainly a very nice bite closure as well. She was an initial treatment with 21 aligners, again changed every 2 weeks. We waited on the TADs. To do her treatment again, I would have placed them sooner. However, in monitoring her visits, we were getting reasonable intrusion, I felt, without them at the start of treatment. We had a refinement then with 5 aligners, again changed every 2 weeks. The lower TAD was removed when the viveras went in. And we had elastics for another 2 months to that upper TAD in her viveras. And we again kept that TAD in for a few extra months just to confirm the stability. And in fact, the stability is very good. We had Roberta back 21 months after our completion of treatment, and you can see the bite is every bit as stable. And I'll have to mention that we will be showcasing this patient and another one in an upcoming book by Jay Park from Arizona. It's going to be temporary anchorage devices in clinical orthodontics, and it's a textbook that will come out in print the end of this month. It is already out in ebook, and there are over 60 authors with various chapters, and I'm honored to have one chapter in that book. So couple tips just to, or before I finish, just to show 21 months later, we're seeing some condyle remodeling, which is a good thing, as well, as we now have a stable function for her, and again, a good bite closure in the ceph as well. So finally, I just want to mention that I've been very happy to share these few nuggets with you, and I hope to have a chance to do it again. So thank you once again, and much appreciated to have this opportunity. I hope to have a chance to share some more cases with you in the future. In the meantime, please visit alignerinsider.com for more videos in their library and to take advantage of the other practice building services. Thanks again, and goodbye for now.